providing how many calories? This is a number which you have to remember. What is that? 175 kilocalories per kg per day, providing a protein intake of 4 to 6 grams per kg per day. This should be your goal whenever you are giving nutrition for these children. And this nutrition can be achieved using the homemade food itself, or there is something else also available called RUTF. What does RUTF stand for? Ready to use therapeutic food. And these are something like easily palatable food which the child can readily take it. So that's what's called ready to use therapeutic food. Now you should know how this food is made. It is actually not a full solid, but it is more like a pasty consistency. And this pasty consistency is made by mixing milk, that means milk solids, sugars, vegetable oils, as well as the peanut paste and butter. These are the ingredients. So you can see that it is not going to be fully a solid one. It is more like a semi-solid consistency one, which the child can easily take, and it is having a good palatability also. One more major advantage is that it has got a long shelf life, so it can be stored for a longer period of time as well. So this is what is a special thing called RUTF. Okay, right? And the nutritive value of RUTF can be sometimes we ask in the exam, which is 543 kilocalories per 15 gram protein per 100 gram of that particular product. So this is the main thing which we follow for nutrition in a child with SAM. Next, in the home management, there are other additional managements also, which you can remember as 3 A's. What are the 3 A's? One is antibiotic should be given, because usually in a child with malnutrition, the immunity is less, and that less immunity can predispose to infection. So it is preferable that you should give antibiotic for these children. The usual antibiotic is oral amoxicillin. That is what is recommended as per the guidelines, which should be given for 5 days. That is number one. The second A is for albendazole. What is the role of albendazole? It is for deworming. Okay, right? Albendazole. Usually worm infestation is an associated problem, so you have to provide albendazole, and the dose depends on the age of the child. If the child is less than 2 years, give a single dose of albendazole 200 milligram, and if the child is more than 2 years, you give a single dose of 400 milligram. This is the guideline. And finally, the A is for vitamin A also. What is that A? Vitamin A dose will be decided by the age of the child. I will write it here. Vitamin A dose. If the child is less than 6 months, it should be 50,000 international units. 6 to 12 months, how much is the dose? 1 lakh international units. And after 1 year, it would be 2 lakh international units. This is the standard dosing for vitamin A administration. Okay, so these are the additional A's which you should remember in the home management of SAM. So we have completed the home management of SAM. Next, I'm going to tell you about hospital management of SAM. Recollect, hospital management is for a child who's having complications or poor appetite or having a complicated SAM only. We are going to do the hospital management, and this is what we remember as 10 steps in the management of SAM. Can you see that? On the left side, 10 parameters I have given, and these are all like individual steps. Okay, right? Now, the first 6 steps here are related to complications. Yes. And how do you remember the complication? You remember the complication with a mnemonic: shielded. Shielded. You can also think like this: a child with a SAM should be shielded from complication like that. Okay. What is that? S stands for sugars or hypoglycemia. That is the first one. S is for the sugars, the hypoglycemia. H is for the hypothermia. Then I is for the infection. EL together is for the electrolyte imbalance. Can you see that? Electrolyte imbalance. Then DE is for the dehydration. Then last D is for micronutrient deficiency. That is what is the last D. So these are the important complications in a child with a SAM. And all these complications should be tackled in the first phase. Can you see 2 phases I have written? First phase is called stabilization phase, and second phase is called rehabilitation phase. Actually, the first 7 days till here. Okay, till here, that is the first 7 days is what is the stabilization phase, which is mainly tackling about the complications. So first, I'm going to tell you about the management of complications, which will be done in the first week of treatment in the management of SAM. Let us start with the first complication, which is hypoglycemia. How do you define hypoglycemia? It is defined by blood glucose of less than 54 milligram per deciliter, which should be remembered correctly. Okay, blood glucose levels of less than 54 milligram per deciliter is called as hypoglycemia. Now, once you detect hypoglycemia, you have to decide whether it's a asymptomatic hypoglycemia or it is a symptomatic hypoglycemia. Why? Because management is based on this classification only. If the child is asymptomatic, you are going to give oral glucose only. Oral glucose. 50 ml of oral glucose or even dextrose containing solutions can be given to the child if it is only asymptomatic hypoglycemia. Suppose the child is having symptoms, for example, seizures are present, okay, and there is hypoglycemia also. Then you will call it as symptomatic hypoglycemia. This is an emergency situation which has to be treated with IV dextrose only. And this dose of IV dextrose is something which you should know by heart. How much is that? It is 5 ml per kg of 10% dextrose should be immediately given. Immediately, like IV should be given this 5 ml per kg of 10% dextrose. Followed by that, you should continue glucose infusions or dextrose infusion should be continued. So the immediate management is what is your usual question, which is 5 ml per kg of 10% dextrose. Don't forget this, an important question. This is how you're going to manage hypoglycemia. Next, second complication is about hypothermia. Again, what's the definition here? It can be defined in terms of axillary temperature or rectal temperature. Axillary temperature less than 35 degrees centigrade or rectal temperature less than 35.5 degrees centigrade is what we call it as hypothermia. Okay, right. Now, obviously, management of hypothermia will be like you have to warm the child by using the protective clothing or covering the child like that. Okay, that should be done. And if it is a very small child, you can even advise kangaroo mother care also. All these are usual ways. But an important point to be noted is rapid should be avoided. Very, very important, because if you do rapid rewarming, there is a problem called disequilibrium syndrome can develop. Disequilibrium syndrome can develop, which will be manifesting as child becoming drowsy, comatose, even child can throw up a seizure also. Okay, so that is why you should always avoid rapid deworming to avoid this problem of disequilibrium syndrome. Okay, right. So that's about management of hypothermia. Third is about infections. Okay, right. As I told you before, malnutrition predisposes to low immunity. That low immunity will result in infections. And please keep a note of this. Usual signs of infection may be absent in a child with severe acute malnutrition. Why? Because when the body's immune system is depressed, the immune response may not occur properly, or in other words, you may not even find fever as a manifestation of infection in these children. So it is safe to assume that all children with SAM are having an infection, and it is very, very important that you should start empirical antibiotics also. Before telling you about empirical antibiotic, first thing to be noted is what are the usual organisms which cause this? They're usually caused by gram-negative bacteria, especially the gram-negative enterobacteria like E. coli, Shigella, Salmonella. They are the ones which usually cause infection in these children. So it is safe to assume infection, and every child admitted with SAM, you have to start empirical antibiotics. What would the empirical antibiotic be? It is usually in the form of ampicillin plus an aminoglycoside like gentamicin or amikacin. This is what we will be starting. Okay, penicillin aminoglycoside combination, typically given as ampicillin and amikacin. However, if there is no improvement by 48 hours, we can switch over from ampicillin to what can you start? You can start a higher order antibiotic. What is that? Third generation cephalosporin can be started. Example like ceftriaxone can be started. This is the usual protocol for management of infections in a child with a SAM. Okay, now I have told you three complications under management. What are they? Hypoglycemia, hypothermia, and infections. Please take a note of this important one. These three complications occur together as a triad. What is the importance of this? Suppose I detect one complication like hypoglycemia, I'm detecting out of the three. Immediately, I will check for temperature because hypothermia is usually associated with that, and also I will immediately start antibiotic because in this setting infections are very common. So these three conditions occur together as a triad, and even if you detect one of this condition, you have to start the management of other two conditions also. That is why this triad association is very important for these complications in SAM. Okay, right. Now moving on to the other important points about the complications. One will be about electrolyte imbalance. First thing to be noted is sodium. See, the total body sodium in a child with a SAM is always high. Very important point. However, if you look at the serum sodium values, it can be normal or even low. Why do you think this type of discrepancy can occur? It can be due to two reasons. Most of the sodium can be intracellular, that is why it is not reflected in the serum values. Number one. Number two is that due to the dilution effect of the edema occurring in case of SAM, there can be dilution hyponatremia also happening. So it is safe to assume that a child with a SAM is always having high levels of sodium, even if the blood chemistry report comes as low sodium or normal sodium. But the teaching is that you should always think high sodium in a child, and you should try to avoid any excess of sodium. For example, excess sodium in the diet and all should be compulsorily avoided while managing a child with SAM. This point should be made a special note. Okay. What are the other electrolyte imbalances? They can also have hypokalemia as well as hypomagnesemia. That is why in the management, potassium and magnesium supplementation should be given for these children. Okay, so that's about a note of electrolyte imbalances occurring in a child with SAM. Then we move on to the dehydration part. Okay, of course, dehydration is a common accompaniment of malnutrition, so many children do have dehydration. But while you test for the signs of dehydration, which I have elaborately covered in the topic of diarrhea in children, please keep a note of one thing, that skin pinch test is always unreliable. I have also provided the explanation why it is unreliable in the chapter of diarrhea in children, but a quick note I'm going to provide it here. Whenever you're doing a skin pinch, it will be dependent on the amount of subcutaneous fat also. In case of malnutrition, what is going to happen to the amount of subcutaneous fat? It will decrease. So that is the reason why skin pinch testing is unreliable in a child with malnutrition. Okay. Instead, you will look for other signs of dehydration. What are the other signs you will look for? Signs would be like thirst, whether it is retained or there is no thirst in this child. You can also look for the urine output. You can also look for the dryness of the mouth or the oral mucosa. All these things will help in assessing dehydration in a child with malnutrition. However, please remember, it may be at times difficult to assess dehydration. So the teaching is like this. It is safe to assume that all children with malnutrition is having some dehydration, and you can go ahead with the treatment. And this correction of dehydration depends on whether the child is having associated shock features or not having a shock. Okay, suppose the usual situation, what is that? Without shock, there are no features of shock. What are you going to give? You are going to give oral fluids only. You are going to give oral fluids only. And which oral fluid is recommended by WHO? It is something called Risomol. What is that? It is rehydration solution for children with malnutrition. RE is rehydration, SO solution, MAL is for malnutrition. So it's a rehydration solution for malnutrition, which is what is recommended. And it will be slightly different from the usual ORS also. I'm going to tell you the differences only. The usual WHO ORS, okay, will have a osmolarity of how much? If you can recollect, 45 milliosmoles per liter. Okay, whereas Risomol will have an osmolarity of 300. It is more. Okay, then we will see the difference in terms of the constituents: sodium, glucose, potassium, and chloride. These are the main things which you have to focus on. In WORS, sodium and glucose will be 75 and 75. Okay, you must be knowing that. Whereas in Risomol, the sodium will be little less, 45. Keep a note of it. What was happening in the child was there is already high sodium inside the body. It is prudent to keep a low sodium level. Glucose is actually more, 125. Why it is more? Because you can understand that hypoglycemia is one of the common complications. So it is better you keep high glucose in the fluid which you are giving. So that is why the glucose content is more. Potassium, usual WORS, it is 20, but in Risomol, it's going to be 40. Again, why? I told you this point that there is hypokalemia noted in children with SAM. So that's why it is better to keep potassium in a little higher value. Chloride level is 65 for WORS and it is 76 for Risomol. These are the major differences between WORS and Risomol, which you should make a note of. And Risomol is a standard mode of treating dehydration in a child with malnutrition without features of shock. That should be remembered. Okay, right. Now moving on to the other one, that is a child is having features of shock. First of all, which fluid you should answer that. Second is, what is the protocol? Which fluid should I use? I will use a fluid which is like Ringer lactate with 5% dextrose. That is a preferred fluid. Why I'm saying preferred fluid? Because dextrose will take care of hypoglycemia, which is an accompaniment in severe acute malnutrition. Ringer lactate contains additionally potassium, which will correct hypokalemia occurring in a child with SAM. So that is why we are preferring Ringer lactate over the usual fluid. What is the usual fluid? Normal saline. So compared to normal saline, Ringer lactate is a better fluid in this particular situation. Okay, right. Now we will see the protocol for management in a child with SAM and having features of shock. In the first hour, you have to give 15 ml per kg. Then you have to repeat the same thing in the second hour also. That is 15 ml per kg in the next 1 hour. And it is usually noted that by this time, the dehydration tends to get corrected. So now you can switch over to oral fluid after the second correction. This is the protocol for management of dehydration in a child with SAM and having features of shock. Okay, last in the set of complication would be related to micronutrient deficiencies. Okay, of course, micronutrient deficiency is a part of malnutrition only. So all children, you should give additional micronutrients in the form of multivitamin supplementation. And it is recommended that you give the micronutrients at twice the recommended dietary elements. This is something important. So you can give it like a multivitamin syrup itself, but it should satisfy the requirements not one time, but twice the recommended elements. That is what you should remember. Now, I will take you back to that picture where I was putting up for the outline of management of problems in a child with SAM. Can you see in micronutrient, what is the first thing which is written? No iron in the first week. Can you see that till the end of 1 week it is no iron, and from the second week alone, iron should be added. Or in other words, you have to avoid iron in the first week of management in SAM. And what is the reason for that? Any reason for that? The reason is iron absorption will be less in the first week of management in SAM. So even if you give iron also, it is not going to be fully absorbed. And because of this, there will be a lot of unabsorbed iron, right? Unabsorbed iron. And this unabsorbed iron is going to cause problems. What is it? It can cause free radical damage to the intestine. Free radical damage to the intestine. So the problems will worsen further. Not only that, the unabsorbed iron will also promote pathogenic bacterial proliferation also. So the severity of the pre-existing infection can actually increase if you give iron in the first week of management in SAM. Okay, so these are the salient points related to micronutrient deficiencies. And with that, I have told you about the management of complications in a child with SAM, which is what is the main thing which we do in the first week of treatment, or phase 1 treatment is stabilization, which is all related to complication. Now we turn our attention to phase 2 management. What is the phase 2? It is from second week onwards, which is called as rehabilitation phase. And in rehabilitation phase, you remember the next 4 steps. Okay, and I'm going to make you remember the next 4 steps like this. Children with SAM require the best treatment. How can we remember? P is like beginning of feeds. Beginning of feeds. That's why can you see in that what I have written first? Cautious feeding. It was something like beginning of feeds, initial feeding. Then E is the energy dense feed. Energy dense feed, which is what referring to catch up growth, the next one. Then S is also written sensory stimulation, stimulation of the child. Then T is like transfer to home care. Transfer to home care. That is what I have written as preparing for follow-up. Follow-up means after you discharge the child and how the child is being managed in the home. That is what is transfer to home care. So this is what you can remember the second phase, best treatment. Okay, right. Now here I have to explain a little bit about the feeding aspect in a child with a SAM. Here you have to remember the first 2 things. What is that? B is for the beginning of feeds and E is for the energy dense feed. Just as a simple guide, you can remember beginning of feeds is what is done in the first week of management, and from second week onwards we will switch over to energy dense feeds. First, let us see the beginning feed. The beginning feed should be something like a relatively low calorie feed, and it is remembered like this: F75 diet is what is advised. F75 diet is what is advised. And what is the meaning of this F75? It is a diet which provides 75 kilocalories plus 0.9 grams of protein per 100 gram of the diet. That is the meaning of F75 diet. We have to start with relatively low calories. Okay, we keep on gradually increasing the calorie so that by the end of first week, our goal is to achieve the calorie supplementation of 80 kilocalories per kg per day, along with the protein supplementation of 0.8 to 1 gram per kg per day of protein. This is what is our goal at the end of completion of first week. That's what you should remember. From second week onwards, I told you, you are going to start energy density. And this energy density is typically given as F100 diet. As you can infer from this name itself, this diet will provide 100 kilocalories plus 2.9 grams of protein per 100 gram of that particular.
हाय हेलो एवरीवन हेलो 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 सो अभी मेरा थोड़ा बहुत पढ़ाई हो गई है बट मैंने सोचा है आई नीड टू सेट आउट माय रूम. हाय उज़मा. हाय ट्रेडर रशिया पढ़ते. यस आई एम स्टडिंग रशिया. 3 हाँ अभी मैं पढ़ने वाला था 3 घंटे पर मैं अभी नहीं पढ़ रहा हूँ 3 घंटे क्योंकि मुझे लगता है कि मुझे अपना रूम थोड़ा सेट करना चाहिए. मैं टेबल चेंज करने की सोच रहा हूँ. सो मैं दिखा देता हूँ. पहले मेरी टेबल यहाँ पे थी. अब मुझे लगता है कि मुझे यहाँ पे विंड शील्ड के पास टेबल लगानी चाहिए अपनी पढ़ने के लिए. और मुझे थोड़ा कॉलर सा लगता है तो इतना अच्छा फील आ नहीं रहा है. व्हाट डू यू थिंक? क्या मैं चेंज करूँ क्या? जस्ट के बाद थम्स अप. फिर मैं चेंज करूँगा तो फिर मैं अपना सामान अपना सेट करूँगा. आप लोग बताएं क्या करना चाहिए. करूँ क्या चेंज? एनी सजेशन गाइस? आप लोग पढ़ रहे हैं क्या सारे? कौन कौन है अभी लाइव में? एक बार जस्ट थम्स अप या लाइक या कुछ करो तो मुझे पता लगे क्या आप लोग एक्टिव हैं इसमें. और आपको मेरी आवाज़ आ रही है? जस्ट के बाद थम्स अप अगर आप मुझे सुन पा रहे हैं तो. कोई कुछ बोलेगा? आप लोग मुझे सुन पा रहे हैं? जस्ट गिव अ थम्स अप. क्या मैं खुद से ही बातें कर रहा हूँ? हाय हाय. हेलो. हाय विस. ओके सो आप लोग मुझे सुन पा रहे हैं. सो फाइनली क्या मैं रूम अपना सेट करूँ? क्या आप लोग मुझे थोड़ी हेल्प करेंगे? ओके सो मैंने जैसे आपको बताया मेरी टेबल इधर से मैं इधर पहुंचाने वाला हूँ. और यहाँ पे जो मैंने बहुत सारा एक्स्ट्रा स्पेस वेस्ट किया हुआ है इस पे अपनी बुक्स रखने वाला हूँ. और एक्चुअली यहाँ पे मैं क्रिसमस ट्री लाने वाला हूँ कुछ दिन में तो वो यहाँ पे सेट करूँगा. अभी तो नहीं, अभी बहुत जल्दी हो जाएगा. अभी अक्टूबर है तो इस एंड नो ब्रो जस्ट स्टडी. ओके ये तो कंफ्यूज कर दिया यार. थोड़ी देर कर लूँ क्या काम, उसके बाद पढ़ूँगा तो चलेगा क्या? मन हो रहा है मैंने बहुत टाइम से चेंज नहीं किया सो आई थिंक थोड़ा सा चेंज बनता है. सो इस वजह से मैं करने की सोच रहा हूँ. आई थिंक इट विल बी गुड. थोड़ा सा चेंज करता हूँ. यहाँ टेबल लगाता हूँ और फिर देन वही ये पहले सारी फालतू चीज़ें हटाऊँ. वहाँ पे कोने में पढ़ने का मन नहीं लगता. यहाँ पे डे लाइट होती है तो यहाँ थोड़ा अच्छा लगता है पढ़ने में. पर यहाँ पे ज़्यादा ठंडी तो नहीं है. नहीं तो मैं यहाँ पे इसलिए मैं सेट करने की सोच रहा हूँ. तो रुको मैं यहाँ पे ये अननेसेसरी चीज़ें हटाऊँ और यहाँ पे अपनी बुक्स लगाऊँ. तो कैसे हैं आप लोग? क्या चल रहा है? आप लोग क्या पढ़ाई कर रहे हो? थोड़ा बहुत मुझे बताओ कौन क्या पढ़ता है. तो आप लोग नीट एस्पिरेंट्स हो, क्या पढ़ाई कर रहे हो? अपना अपना बताओ. मैं भी, मेरा तो पता है शायद आपको. मैं रशिया में हूँ, MBBS कर रहा हूँ. क्या मैं आवाज़ आ रही है? रुको मैं एयरपोर्ट्स लगाता हूँ. आप लोग क्या पढ़ाई कर रहे हो? कोई कुछ बताना चाहेगा? ये देखो मैं ये इंडिया से लाया था. ये भी नहीं, ये तो गिफ्ट, ये गिफ्ट है, गिफ्ट है. ये मैं नहीं लाया था. ये सारी गिफ्ट है. वैसे एक्चुअली मैं लाया कुछ भी नहीं हूँ. हम्म, ये ड्राइंग शीट थी. मैंने सोचा था कभी ड्राइंग बनाऊंगा इसलिए ये लेके आया था. बट अभी तक बना ही नहीं हूँ. वो कुछ तो बनाया था. एक सेकंड में दिखाता हूँ आप लोगों को. ये बनाया हुआ था और फिर ये मैंने अपलोड, ये फिर आगे किया ही नहीं. बहन जो इतना गंदा बना, सॉरी, इतना गंदा बना दिया इसलिए फिर मैंने छोड़ दिया. आई लिव इन रशिया. हाउ कैन यू नॉट नो ब्रो? एवरीबॉडी नोज. तो अभी मैंने इतना सामान, अभी मुझे लगता है मेरे कम एंगल गलत है इसका, तो क्योंकि आप लोगों को दिख नहीं रहा है कि मैं अभी क्या कर रहा हूँ, सिर्फ मैं दिख रहा हूँ। अभी आपको शायद दिख रहा होगा मैं क्या कर रहा हूँ। हाँ, पहले मैं ये हटाऊँ, इसको साफ करूँ, फिर यहाँ पे बुक्स लेके आऊँ, फिर उसके बाद टेबल लगाऊँ, तब थोड़ी बाहर मैच होगी। ये वाला कॉर्नर थोड़ा छोड़ो वाला खाली, क्योंकि यहाँ मुझे क्रिसमस ट्री लगाना है, जिस वजह से मैं इसको खाली छोड़ने वाला हूँ। तुम क्या पढ़ाई करते हो? क्या नाम है? बिस क्या? व्हाट यू आई लिव इन रशिया। क्या पढ़ाई करता है? हेलो हेलो एवरीवन। ये कुछ बताएगा आपको? ये भी ये भी लेके आया हूँ, ये गिफ्ट तो नहीं है पर आई एम जस्ट नॉर्मल स्टूडेंट। ओके भाई, नॉर्मल भी तो कुछ तो पढ़ स्कूल में है, क्या है? आई एम जस्ट नॉर्मल। ब्रो यू कैन रिकमेंड मी हाउ टू लर्न फिजिक्स प्रैक्टिकल। ओ नाइन्थ ग्रेड, वो तो बहुत छोटा है। नाइन्थ ग्रेड मेरे को तो याद भी नहीं मैं कब नाइन्थ ग्रेड में था। नाइन्थ ग्रेड हुए भी बहुत साल हो गई हैं। I don't remember when I was in ninth grade. It's all के 12th बोर्ड के प्रैक्टिकल, फिजिक्स का प्रैक्टिकल। ओके, डोंट टेक स्ट्रेस, स्कूल वाले पास कर। इतना 12th के मार्क्स और इन सब को लेके स्ट्रेस मत लेना कभी। ये फुद्दू चीज होती है। मैंने अपना टाइम वेस्ट किया हुआ था 12th के मार्क्स और इन सब को स्ट्रेस लेके, तो कोई फायदा नहीं है। जितना आ रहा है उतना आ जाए, ये है। आगे के लिए सोचो क्या करना है। क्या नीट नीट एस्पिरेंट हो क्या? नो, ये 12th का जो पूछ रहा है वो क्या मैथ्स वाला है या जेई वाला है? वो सॉरी, जेई वाला है या नीट वाला है, या फिर इन दोनों में से कोई नहीं है? बोर्ड्स के लिए, हाँ, बोर्ड्स के बाद तो भाई कुछ करेगा ना यार, कि 12th के बाद पढ़ाई बंद करने वाला है? उसके बाद तो कुछ तो करना ही। देख, तुम लोग आराम से मोबाइल चला रहे हो, मैं देखो अपना जो लुक डूइंग। व्यू तो तुमको बाहर का नहीं दिख रहा होगा, अभी तो स्नो स्टार्ट ही नहीं हुई है। मतलब हुई थी 2 दिन गिरी, फिर वो मेल्ट हो गई। अब मैं चाह भी नहीं रहा हूँ कभी स्टार्ट हो जाए, बहुत जल्दी हो जाएगा भाई। इतनी जल्दी स्नो स्टार्ट नहीं आती है, तो बहुत प्रॉब्लम होती है। अब ये होगी मेरी साफ एक। बोर्ड्स के आगे क्या यहाँ पे ठीक है। तो ये मैंने इस जगह पे रखता हूँ। और कुछ कोई टिप्स है भैया किसके लिए? नहीं, प्रैक्टिकल्स के लिए भाई कोई टिप्स नहीं है, ऐसा कुछ नहीं होता प्रैक्टिकल्स में। प्रैक्टिकल्स में जो बाहर का बोलते हैं कि यूनिवर्सिटी वाले की याद वो स्कूल वाले वैसा कुछ करवाते नहीं है, हमारे स्कूल वाले सारा कुछ कवर कर लेते हैं। वो तुमको मार्क्स उतने ही देने वाले हैं, आपको स्कूल वालों से अच्छी बनती है वैसे थोड़े अच्छे दे देंगे, नहीं बनती है तो वही मैं 27 तो सबको मिलती ही है, सो तुमको भी मिल जाएंगे, इतना मत सोचो। सन में बना तो अपनी जान दे दो सोच सोच। उसकी फाइल तो बना ही ली होगी आई गेस, कि नहीं बनाई है? फिर भाई theory के लिए कैसे? अरे जो नॉर्मल तुम पढ़ाई बोर्ड्स के लिए करी हुई है ना, उन्हीं में से एक आध दो क्वेश्चन पूछ लेंगे, वही बता देना है तुमको। कुछ स्पेशल नहीं है उसके लिए। पूछो कुछ स्पेशल हो ऐसा कुछ नहीं है, जो बोर्ड्स के लिए पढ़ रहे हो ना, उसमें से ही कुछ ओम्स लॉ का फॉर्मूला वगैरह कुछ पूछेंगे। मेरी बुक्स रखी हुई हैं, इसे बेचारी सो रही हैं। निकालूँ क्या कि रहने दूँ? अपनी किताबें दिखाता हूँ तुम लोगों को, ईवीएस की। ये है भैया आप भैया आप क्या पढ़ने वाले हो? तो एमबीबीएस कर रहा हूँ भाई, ये देख एटॉमिक हैबिट्स, ये सारी निकाल के रख दूँ, तो बहुत टू मच हो जाएगा आई गेस। तो जो पढ़ रहा हूँ बस वही-वही निकाल, ठीक रहेगा। वो क्या है ना, अब मैं बोल रहा हूँ कि अगर मैं सारी किताबें निकाल दूँ, बहुत टू मच ऑफ बुक्स हो जाए, तो सारी निकाल। हुँ, देख लिया? मुझे तो नहीं अभी अच्छा लग रहा है फिलहाल। नहीं, अभी तो अच्छा लग रहा है। थोड़ा कम्फर्ट है, ये है। तो तुम्हारा भी अच्छा है। ये तुमको नहीं बोल सकता। थोड़ी निकाल के रखता हूँ जो सब्जेक्ट इस बार मैं खत्म करने वाला हूँ। ये थोड़ा ये करेगा, खत्म करने वाला हूँ। अभी जाके पढ़ना गुड। अभी पढ़ने ही वाला था, थोड़ा चेंज करूँ। मैंने कहा कर लेता हूँ, अब तो मेरा मन ये नहीं था कि मैं अकेले-अकेले चेंज करूँ, तो मैंने सोचा तुम लोगों से बातें करके मैं कर लेता हूँ चेंज। ईएनटी फॉरेंसिक मैंने इस साल नहीं, डरमा रेडियो, फार्मा इस साल करने वाला हूँ। हुँ, बायोकेम, एएनटी, फॉरेंसिक मेडिसिन, तो एनेस्थीसिया, फिजियोलॉजी, माइक्रोबायोलॉजी। पता है एमबीबीएस में कितने सब्जेक्ट्स होते हैं? ये आपका साउंड कट रहा है। कैसे कट रहा है? मैंने तो एयरपोड्स लगाए हुए हैं। अभी आ रहा है ठीक है नहीं आ रहा है? वो एक्चुअली मैं सामान निकाल रहा था तो इसकी वजह से। हाँ, तो ये जो-जो सब्जेक्ट मैं इस ईयर खत्म करने